Or as I like to think about it, my stroke is a pain because, it's kind of a pain to have a stroke sometimes. I have given this talk to this group, but it's been like 3 or 4 years and I did update it. So if you've heard this talk before, hopefully you'll still learn something new today. So my goals today is to just look at what are the most common causes of pain after stroke. Try to help you guys understand why the pain is there and what it might be telling you, and then know what you can do to help reduce your pain after stroke. Because the message is there is a lot of things that we can do that might help with your pain. So first, I want to talk mostly about shoulder pain because there are some common causes of shoulder pain after stroke. And at least when I see people in my clinic, we end up talking a lot about shoulders. So I thought I'd start there. So this was a study from a couple years ago, and it just looked and interviewed many different patients who'd had a stroke and talk about where do they have pain and what is their pain caused by. And joint pain was kind of the biggest group. So 40% of people had reported joint pain after stroke. So that's like that big orange circle. More specifically, 20% reported that the pain was actually mostly in their shoulder. And so that's that pink circle there. That's kind of a little smaller. Some people did report headache, which is kind of the green circle off in the corner, so 10%. And then some people also report what we call central post-stroke pain, which is also called nerve pain or neuropathic pain at about 8%. 7% reported spasticity, that was painful or painful muscle spasms in their arm or leg. And then very, very rarely, there's something called complex regional pain syndrome, which is a special type of nerve pain. Only 1% in this study reported that type of pain. But I think you can see from the diagram that oftentimes these things overlap, and it can take a while to sort out what is causing your individual pain, and maybe trying to treat a couple of these things together can sometimes get you some relief. So we're going to focus a little bit, like I mentioned, on shoulder pain to start. So these are some pictures of what anatomy looks like in your shoulder. So on the left, there are the bones that make up the shoulder. The arm bone is called the humerus. The shoulder blade is also called the scapula. And then your collarbone is also called your clavicle. And those three bones come together to make the shoulder joint. It's a complicated joint. And it gives our arms a lot of mobility. It allows our arms to move up all the way overhead, behind our back in different directions. But because you have so much mobility, the shoulder is not very stable. So what really helps keep our shoulders stable is the muscles that go around the shoulder joint to hold it all together. And so that picture on the right is a picture of the rotator cuff muscles. So you've probably heard of rotator cuff. It's very common to have rotator cuff injuries. And after stroke, sometimes you get hemiplegia, where half of your body is very weak. And it's not just your arm or your leg that's weak. It's also the muscles in your trunk and the muscles in your rotator cuff. When they're weak, a lot of times your shoulder gives you a lot of grief. So I just wanted to show you those pictures so you can have a visualization of what happens in our shoulders. So normal shoulder motion, so lifting your shoulder and moving it, is kind of a complex orchestra of all these different muscles rotating and moving your shoulder for you. And like I mentioned, the shoulder joint has a lot of mobility, but not a lot of stability. So normally the shoulder blade or scapula rotates to allow normal arm motion. And so you can see in this picture on the left, these complicated triangles are showing you that in order to lift your arm overhead, your shoulder blade rotates, and that is accomplished by coordinating movements in these muscles throughout your shoulder and your back. The trapezius has different parts that pull in different directions. And then another muscle called the serratus anterior pulls in a different direction. And the result is that your shoulder blade rotates to allow your arm to move. This movement helps us avoid rotator cuff injury or rotator cuff impingement, which is very, very common. And so when our shoulders are moving normally, when the shoulder blade rotates, that helps to avoid that. So I kind of showed you the pictures of the bones and the muscles. Rotator cuff impingement or shoulder impingement is something that happens when the shoulder blade and the rotator cuff doesn't move normally, and the bones kind of crunch together underneath your collarbone and give you some pain. And so under here, there's a fluid-filled sac called a bursa. And basically, when you have rotator cuff impingement, your shoulder mechanics are off. And so when you go to lift your arm, rather than your shoulder blade rotating, you get impingement and you get pain in your shoulder. And that can happen because of rotator cuff injuries, and it happens very commonly after stroke. So after stroke, if you have hemiplegia or weakness on one side, the muscles, like I mentioned, including your rotator cuff muscles, don't hold the shoulder in place. And so a lot of times, especially right after a stroke, your arm will kind of hang down from the shoulder joint. We call that subluxation. The other thing that we just talked about is that the shoulder blade or scapula doesn't rotate. And so those two things together lead to early rotator cuff impingement and pain. And so this is just another picture of the muscles and showing you how all of those muscles need to be working together in order to reduce impingement in your shoulder. And so after stroke, you get a lot of impingement. In addition to the shoulder mechanics, posture after stroke is really important because poor posture can actually make shoulder pain worse. So if you are sitting in a wheelchair and you don't have very good posture, and you're kind of hunched over and leaning forward, that's probably not going to feel very good on your shoulder. And sometimes this could be because the chair that you're sitting in doesn't fit you very well, or maybe the seat back is kind of a sling and not supportive enough. A lot of times, if you don't have a good arm support on the armrest of your wheelchair, like this arm trough down here, or sometimes a lap tray, your arm will just kind of hang down and cause a lot of pain. If you're leaning forward and your spine is curved and your shoulders are rotated in and your arm is hanging down, all of those things are going to make your shoulder feel worse. So one of the first things we do is look how people are sitting in their wheelchair and see if we can make that better by some simple adjustments to their wheelchair. So this would be a better sitting posture. So you can see this person in the blue is sitting up nice and tall. They have a good angle of 90 degrees at their hips. They have a good angle of 90 degrees at their knees and 90 degrees at their ankles. And this chair fits them well. They're supported. They have a good support in the back as well. And so something as simple as posture can actually help your pain. In addition to the arm trough, this is the lap tray that some of you might have. And that's something that you can work with either a therapist or your physician to get ordered if that's something that you don't have, but you think you might need. So some people wonder, well, why does my arm hanging down cause pain? And so that subluxation, which is, your arm kind of hanging down from the shoulder joint, it just puts a lot of stress on your shoulder muscles and tendons. And so this is just a picture kind of what that could look like if it was really severe, where the joint just isn't together and putting stress on that shoulder. And like we already mentioned, if you have rotator cuff impingement, when you lift your arm, you could get other issues in your shoulder like bursitis, tendonitis, rotator cuff tears. So over time, if you don't treat the proper mechanics of the shoulder, it could kind of just lead to a lot of other issues down the road. And then if you have a lot of pain from one of these conditions, like bursitis or tendonitis, it's going to hurt. And our natural tendency when we have pain is sometimes to kind of protect our arm and not move it because it hurts. And we call that guarding. And if you guard it too much, the problem is you could end up with a frozen shoulder. Frozen shoulder is a real medical condition, and it usually is the end result of some sort of shoulder injury that hurts, and then people stop moving, and then all the ligaments and tendons within your shoulder get really, really thick and tight, and it feels like your shoulder is frozen because you actually can't move it then, even when you do try. So that's what we want to avoid. So with shoulder subluxation, so we talked about the arm kind of hanging down from the shoulder joint. Like I mentioned, this often occurs early after stroke, kind of in that initial period where you're really not moving your arm very much at all. The shoulder subluxation often resolves once you start to develop spasticity. And that probably is because those rotator cuff muscles are starting to get spastic and they're just slowly pulling your shoulder back together. So even though spasticity can be a problem, in this case, it might help because it would reduce that subluxation. But if you don't manage a shoulder subluxation early, it really can lead to pain and maybe even rotator cuff injury, like we mentioned, just because the arm is not in a good position and it's pulling tension on those muscles. So then the questions usually are, well, what can I do to manage subluxation? So if you still do have kind of a separation of your shoulder, proper positioning is the first and most important thing. So when you're laying in bed, you want to support it with pillows or put a foam wedge under your arm or have a family member do that. If you're sitting in your chair, you might need, like we talked about, an arm trough or a lap tray, just something to rest your arm on so it's more supported. If you are somebody who stands and walks or stands for transfers and your arm kind of hangs down at your side and that's painful, there are several different slings available on the market. The one on the top right is called a Give More sling. I don't know if I can move this. I'm gonna try to move it. So the one on the top right is called a Give More sling. It's got a nice harness around both shoulders. This is a cuff style sling. Again, there's a harness and it kind of just supports the shoulder. This is a sling envelope style, which also can work, but for some people, this actually puts your arm in kind of a bad position. So it's not my favorite sling, but sometimes it works for people. So we're usually pretty flexible. But these types of slings are things you can, your physician could order you. You can work with a therapist to try different ones and see if it helps. Honestly, you can go on Amazon these days and order all sorts of medical equipment. And a lot of times you can see what's available online. Regular shoulder stretching is also very important. So if you are really that weak in your arm, this usually requires some assistance from family or a friend. You can go to physical or occupational therapy to have this addressed and get some ideas of what to do at home. If it is painful, your physician might be able to offer you some medications. And then I'll show you a little bit about these two things called kinesio taping and electrical stimulation. I think I have 2 slides on those, yeah. So this is what kinesio taping looks like. It's different types of taping techniques. They're usually done by a therapist. And if you looked at like the research clinical trials, it's maybe mixed results. However, anecdotally, it's something really simple to try. You can buy this tape and learn how to apply it from like a friendly therapist. And you might notice if you're watching the Olympics lately that athletes use this types of tape in different applications. And I was watching diving last night and the divers had this stuff on their shoulders and I was like, of course, it's kinesio tape, it helps. So it's used for a lot of different things, but sometimes people get their shoulders taped and it just helps it feel good. This is a little bit about electrical stimulation. So electrical stimulation is kind of a little battery pack with some pads that you stick on your shoulder over different muscles. And if you apply that electrical stimulation, it activates the muscles and over time might reduce pain and may reduce the subluxation. So again, this is usually initiated by a physical or occupational therapist. But if it helps, it's a kind of like a little medical device that you can take home and use it at home. I have different people I've worked with over the years that purchase home electrical stimulation units for different things after stroke. They might use it for their hand to help open and close their hand, and then we learn how to apply it on our shoulder, and it also helps our shoulder. So there's some cool options out there. So the next slides are just a little bit more about what happens if your shoulder pain kind of goes on and you end up with like a rotator cuff injury. So that could be bursitis, tendinitis, hopefully not a rotator cuff tear, but it could come to that. So the bursitis and the tendinitis just means inflammation of the tendons and bursa around your rotator cuff muscles. But if those go untreated over time, they could lead to rotator cuff tears down the road. And of course, we want to prevent that if possible. Some studies found up to 40% incidence of rotator cuff issues in stroke survivors. Oh, sorry, that's really loud. Is that too loud? They're testing the fire alarms.
We're okay. Yeah.
Okay, I'll keep talking. If it's too loud, let me know.
Okay. Perfect timing.
At the hospital and they're checking the fire alarms, of course, right now. Other people found really no relation between stroke and rotator cuff tears. So I think it's a mixed bag, but I do think we have to think about our rotator cuff if we do continue to have shoulder issues in the long term. So if you do have a rotator cuff injury or you suspect that you do, you know, ice and heat are really simple modalities that can help with pain. Again, regular shoulder stretching can be something that will help with time. You might need to modify your activities if there's certain things that you do that really, really bother your shoulder. You might need to kind of adjust how you do those activities or get help. You might do a short course of physical occupational therapy, or perhaps your doctor can prescribe you some medications. We occasionally will do shoulder injections of steroids to kind of get these to calm down. And we really try to reserve surgery if there's just a really, really severe tear or really other things don't help. But most people don't need surgery for a rotator cuff injury. So then I also wanted to talk a little bit more about that frozen shoulder. The medical term for that is adhesive capsulitis. And so kind of like we talked about, shoulder pain leads to guarding, leads to decreased range of motion. So you just don't stretch your shoulder as much, and then that joint capsule thickens up, and then it's very painful and stiff. So one study, which is, it's old, I admit, but found that like 3/4 of painful stiff shoulders after stroke had a frozen shoulder. And I will say we do see this pretty commonly, at least at some point during stroke recovery. The good news is there is a lot of things you can do to manage frozen shoulder. The biggest thing is to try to use that arm, use the weak arm, don't avoid your weak arm, because it's kind of like a use it or lose it situation. You got to move. Movement is medicine. And if you can keep that shoulder moving, hopefully you can avoid getting this frozen shoulder. So regular shoulder stretching is so important. A course of physical therapy might be helpful. If that doesn't work, we can do steroid injections, and those usually loosen it up. And if nothing else works, you can get a surgical manipulation under anesthesia, but I wouldn't recommend it if you can get away with some of these other things, because it's pretty severe. I mean, they literally knock you out and then just forcefully like move your shoulder. So I don't think it's for the faint of heart, but it is available. We just try to avoid it if we can. And usually these other things work. All right, so that is kind of the big overview of shoulder pain. And then we're going to go over a couple other common causes of pain after stroke. So spasticity is a common cause of pain after stroke. Um, so spasticity is an increase in reflexes and muscle tightness that occurs very commonly after stroke. It affects probably 23% of stroke survivors, and it becomes problematic in about 30% of stroke survivors. So it can become painful, it can interrupt sleep, and it really can affect your function if your muscles are so painful and tight that you can't really use your arm or your leg the way you want to. So spasticity, again, you'll notice a theme. A lot of these conditions are treated by regular stretching. So stretching is always a good idea. Sometimes if the spasticity is really severe, you might need a brace for your hand or your foot, just to kind of stretch it out, especially when you sleep. Physical and occupational therapy can help for a short time, and mostly it's just to learn exercises to do at home. There are a lot of different medical options for spasticity treatment. So if you see me or one of my partners in clinic, usually we're talking about medications, Botox injections, baclofen pumps. There's a lot of things we can do to help with spasticity. And again, there are surgical options, but really we try to avoid those unless we absolutely need to go there. So spasticity is kind of its own big topic, and I'm not going to delve into it a lot today, but there's a lot of things you can do to help. Complex regional pain syndrome is kind of a small subset of pain after stroke, but it is kind of its own special entity. So it involves nerve pain after really any type of illness, injury, or nerve damage. By definition, it affects only one limb. And in stroke, it is also called the shoulder hand syndrome. And it's called that because it tends to cause really severe shoulder pain. And for whatever reason, it avoids the elbow. And then you jump down to the hand and you have severe pain and swelling and redness in your hand. So if you look at this picture, the hand on the left obviously is quite swollen, a little bit red, and you see kind of the edema on her fingers and palm. And it's also very, very sensitive. So you just lightly touch it and it tingles or it burns or like something brushes up against it, and it hurts. And that's basically what complex regional pain syndrome looks like. It's pretty rare. It only affects probably about 1% of stroke survivors. But if you've had more of a severe stroke, really severe hemiparesis and can't move your arm very well at all, if you lost sensation after your stroke, those are all risk factors for developing complex regional pain syndrome. So here are kind of the symptoms and signs of complex regional pain syndrome. So kind of on the left is what in general this diagnosis looks like. And then on the right, there's a couple things that are specific to stroke. So people can get complex regional pain syndrome after like a traumatic injury, like something fell on their hand at work, or they broke their ankle and they were in a cast for 3 weeks. You can get this as well. So in general, it's described usually as burning pain, increased skin sensitivity, changes in skin temperature, so that limb is either warmer or cooler compared to the other side. Changes in skin color, so it's often blotchy, purple, pale, or red, can be all different sorts of colors. The skin texture changes also, it kind of gets shiny and thin and sweaty. And then if it goes on long enough, your nail and your hair growth can change. So your nails get really brittle and you actually lose hair on that limb. And then it is associated with swelling and stiffness. In stroke specifically, like I mentioned, it involves the shoulder, and then for whatever reason, it just goes down to the hand. There is a lot of tenderness in the hand joints. So one of the things I will do is just gently squeeze your knuckles and see if that's painful, because that should not be painful. And if it is, it kind of makes me think, well, maybe we have shoulder hand syndrome. There also might be pain with just very gentle range of motion. So I will stretch people's fingers and wrists out very gently and see how painful that is. And like I mentioned, it is more associated with folks that have had severe weakness, sensory loss, or maybe a severe shoulder subluxation right after their stroke. So here's just another picture kind of some of the color and texture changes. So this hand is swollen, fingers are swollen. The skin is really pale and shiny compared to the other side. And then it's a little bit mottled in red here, kind of along the knuckles. And in the palm too, you can just see like that mottling and redness. So luckily there are a lot of things you can do to manage complex regional pain syndrome. The biggest advice is to use the painful arm. So it hurts and you're not going to want to use it, but the best advice is to use it, because the more you use that arm, it will actually start to feel better. Another thing that we teach people is called desensitization. That is basically very, very simple. You just tap, rub, or massage the painful arm. You can use cotton balls or rub different textures of cloth on there. But that massaging action actually reduces pain. We're going to say it again, regular stretching is so important, and it does also help with complex regional pain syndrome. If you have a lot of swelling, you can get a compression glove and wear that to kind of reduce the swelling in your hand. There are some things that our physical and occupational therapy friends can help with, some techniques that they can do. Oftentimes, if this goes on long enough, it can cause people to feel kind of down and depressed. And so psychology can be helpful. There are pain psychologists that can be very helpful. There's a slew of medications and even a couple injections that we can do to help this. So once it's diagnosed, there's actually a lot of great things that we can do. So here are some things that therapy actually can do for complex regional pain syndrome. So there is something called contrast baths, which is basically just alternating between warm water and really, really cold water. And it's almost like you're shocking the nerves by changing the temperature of the water. And doing that over time actually reduces pain. Desensitization, like we mentioned, that tapping, rubbing, friction massage, gentle stretching and strengthening exercises to get used to using that limb again, edema control, either by a glove or some wrapping techniques. There's something called stress loading or scrubbing, where you intentionally put weight through that painful arm, and that actually helps to reduce the pain. Can also look at ergonomics, like posture, like we kind of mentioned already, and do some movement therapy to kind of normalize using that limb again. And of course, restore function, which is part of all therapy. And then there's also this cool technique with mirror therapy, where you can actually look at your limbs in mirrors and do movements, and that actually over time reduces pain. So again, a lot of really good evidence, evidence-based therapies once you kind of know what you're treating. This is just one study that did look at mirror therapy. And so you can see down here, a lot of times mirror therapy is just really simple. It's just a couple pieces of foam with a mirror like glued or taped, and you put the hemiparetic weak or painful arm inside the box, and then you put your other arm outside the box, and then your eyes are looking at the mirror image of your good limb so that you see the mirror image of your intact side. But inside the box, your hemiparetic arm is still trying to mimic and do the same motions. And then you basically go through different motions of making hand squeezes and opening your fingers and turning your palms over, and visualizing that through the mirrors. It's actually a really cool therapy. It helps a lot of things in stroke. So this study looked at 48 acute stroke survivors and did mirror therapy just for 4 weeks of daily treatment, just either 30 minutes up to an hour. And they looked at their visual analog pain scale, just the 0 to 10, do you have no pain or the worst pain you've ever had. And so you can see at baseline, both groups had about the same amount of pain. At the end of 4 weeks, the group in the blue that did the mirror therapy reported about a 4 out of 10 of pain, compared to the people who didn't do the mirror therapy still had about a 7. And even 6 months later, those people who did mirror therapy still had less pain. And the people who didn't do anything had more pain. So mirror therapy is a really great addition if you do have a lot of pain from nerve pain in your arm. So that was talking a lot about shoulder hand syndrome. You can also just get more generalized neuropathic or nerve pain after stroke. It is basically pain occurring after stroke that's located in the areas of the body that lost sensation. So in some people, half of their body is numb after the stroke. And then later on, that same half develops severe nerve pain. And basically what the brain is doing is saying, I don't feel anything. I feel numbness. So I'm going to substitute severe pain because I don't feel anything. And that's, of course, not great, very maladaptive of the brain, but that's what happens. So a lot of times you might hear it called thalamic pain syndrome. The pain pathway in the brain goes through an area of the brain called the thalamus. And so originally, neurologists thought that you had to have a thalamic stroke to have this type of pain. But we now know that this black little wire here is the sensory pathway from all the way to the top of our brain, all the way down to our arms and legs. And so really anywhere along this pathway, you can have an injury like a stroke and get nerve pain. So it's pretty common. It affects maybe 8% of stroke survivors and becomes painful or problematic in about 5%. The symptoms are described usually as burning or aching pain. It can be worse with movement. Often is very sensitive to cold. So wintertime is not great because you go outside and all of a sudden you're getting like electrical pains in your arm or leg. It can also be very sensitive to light touch. So just brushing up against it can be painful. And some people think that the neuropathic or nerve pain can be related to emotions. So if you're going through a stressful time or feeling kind of down and depressed or maybe very anxious, your neuropathic pain might actually get worse. Fortunately, there are a lot of things you can do to manage neuropathic pain, and it's very, very, very similar, almost identical to complex regional pain syndrome. So the general advice is use the painful side, don't avoid the painful side, tap, rubber, massage it, do regular stretching. We could do therapy if we need to, pain psychology, medications, injections, all the same things can really help with neuropathic pain. And therapy, these are the same list of things for central post-stroke pain or neuropathic pain as that previous diagnosis. So the contrast baths, desensitization, all that list, it's pretty much the same thing. You pretty much treat nerve pain the same, no matter what's causing it. All right, so I'm going to finish early, so I'll give you guys back some time with your day, which is never a bad thing. But my take-home points are that pain is very common after stroke. And so if you're having pain, don't ignore it. Tell somebody about it, and there might be some things that you can do to get rid of your pain. Just general advice, things that you can try on your own if you do have pain. The common theme from all of these things, from shoulder to joint to nerve pain, is try your best to use that weak side. Don't avoid it, because the more you use the weak side, the better your function will be, but also the better your pain is going to be. Really focus on good positioning and posture. You know, if you are in bed, make sure your arms and leg is supported. If you're using a wheelchair, make sure you have the right armrests. If you're standing, make sure you have the right slings and braces so that you don't put yourself in a bad position. Regular stretching is always helpful, especially for that shoulder. Ice and heat are very simple things that you can try at home. And if those things aren't working for you, talk to your doctor about other options. There are a lot of great things we can do to treat pain after stroke. And so it's good to be aware and see if there might be something that will help you. So I have to make a plug for my specialty, but physiatry, that's us, physical medicine and rehab doctors. So we diagnose and treat pain after stroke. We prescribe therapy if needed. We can recommend and order different medications. We can order braces and positioning devices. We can do injections if we need to do steroid or Botox injections. And then if you need to see a surgeon, we can refer you over there, but really only if needed. We try to do all the conservative management and use all the tools in our toolbox. All right, so here's that picture again. So just as a reminder, the musculoskeletal or joint pain is kind of the biggest bucket, right? Followed by shoulder pain, but then these smaller circles are really nerve pain. So I think that is all I got. And I think we have time for